Hey everyone, let's do a quick recap on schizophrenia. This is the key information you'll need to know for your NCLEX. So when you think about schizophrenia, I want you to categorize those symptoms in negative symptoms and positive symptoms. Negative, think about that person that's in a depressive-like state. They're having difficulty getting out of bed, there's no emotion, they're not wanting to engage with others, they have slower thought processes. Now, positive symptoms, I want you to think about those symptoms that aren't normally present for individuals. That would be things like your hallucinations, your delusions, and your disorganized speech. Let's transition to medications. Your go-to medications are going to be those antipsychotics. Your first gens are typicals or your second gens atypicals. Oftentimes, we're going to go to the second gens or atypicals because they have a safer side effect profile. However, those aren't going to work effectively for every single patient, so sometimes those first gens are going to be used. With those, you are at more risk, or your patient's more at risk for EPS side effects or those extrapyramidal symptoms such as tardive dyskinesia. Know that and how we would manage that. With your second gens, you do still need to monitor patients because they can experience things such as neuroleptic malignant syndrome associated with Clozaril. That would be where they experience muscle rigidity, sweating, fever, increased blood pressure, increased heart rate, as well as some confusion and agitation. We'd want to stop the medication, hold the medication, and talk to the provider, and then wait until we have further notice. So make sure that you know those next steps. Agranulocytosis would also be something we'd want to monitor for. With that, we would do some labs such as white blood cell counts and absolute neutrophil counts. Now, keep in mind with both of these types of meds that they are going to experience anticholinergic symptoms. So that would be those drying symptoms, dry mouth, constipation, drowsiness, blurred vision. So oftentimes we will give these patients stool softeners to help avoid that or help eliminate the risk of constipation. Last and not least, let's talk NCLEX tips. Therapeutic communication is going to be key. Always assess safety first. Is there any signs of suicidal ideation or aggression? Medication adherence is key. Stopping those meds will lead to relapse. They need to be on meds for the rest of their life to manage those symptoms effectively. Those medications aren't going to be a cure-all. A lot of them will still experience some voices or hallucinations. With that, they need to develop coping strategies, to make sure that they can manage through those symptoms effectively. And know you're monitoring with your labs and different meds. I hope that helps, and best of luck studying.